The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody, and welcome to the AHP Dementia Webinar on Wednesday, the 22nd of February, 2023. My name is Wendy Chambers, and along with Alison McKean today, we are your webinar hosts, and we're joined online by Karen Mellon, and Karen's from the Podiatry Service in NHS Fife. So we just go to the next slide, Karen. And before I pass over to Karen, I'm going to just do a couple of bits of housekeeping. So you're joining today in listen-only mode, but we really want to hear from you, and Karen would really like to hear what your questions are about what she's going to be talking about. So if you hover over your screen or move your mouse, or if you're on an iPad, you might need to reduce your screen to do this. If you hover over, you'll find a question box. And you can put your questions to Karen, and Alison and I will be doing a Q&A with Karen at the end, so we'll put your questions to her. Also, you are joining in listen only mode, but we are recording the session and we'll be emailing out the link to everybody to either listen again or to join. If you haven't been able to join today, you'll be listening in your own leisure time. So, before I pass to Karen today, I'm just going to check who's in the audience. So far, we've got quite a few people in the room. So as you join in the room today, can you let us know who's in the room? So are you someone living with dementia in the room today? Are you an allied health professional, an other healthcare professional? So you might be a nurse or a medic or psychologist. Are you from social care or third sector? Or other, and other, you might be a student. You can put your name down in more than one area. So we've got quite a lot of votes coming in already in the poll. Super. So I'm going to leave it open for a little bit longer. Most people have voted, but I'll just give you a few more seconds. Okay, that looks like most people have ticked a box now, so I'll close that. Oh. And I'll share the results. Sorry. So today, Karen, in her room, 3% of our audience are someone who's living with dementia. 34% are allied health professionals. 7 are from other healthcare professionals. We've got a large number of people from third care, social care or third sector. And we've got 14% of people are other. So I'm going to ask another poll question about the allied health professionals specifically, or who are in the room. So Karen was interested to know, if you're an AHP and you've joined us today, can you let us know, of these 5 types of professions, which profession are you? Okay, so it looks like we've got everyone's put a response in, and this is quite interesting. I'll close and I'll share the results. So today, Karen, 20% of the audience are podiatrists and 80% of the audience are occupational therapists, from the percentage of the audience that were from allied health professions. So without further ado, Karen, I'll pass over to you. Thank you.
Brilliant. Thanks very much, Wendy. Thank you, everybody, for coming along this afternoon to hear about our Podiatry Talking Mats project. Really appreciate you coming along today and spending the time to sort of hear about the project and having a bit of an interest in it. I'm just going to move to the next slide there. I'll be delivering the presentation today, but Lois Cameron, who's the director of Talking Mats, also contributed to the development of this presentation as well. What I'm going to talk about is a little bit about the history around Talking Mats and how I kind of got involved in Talking Mats, how we then started looking at developing a podiatry-specific Talking Mat, and how we then took that into our everyday practice, and what the future is going to look like in that as well. So that's what I'm kind of hoping to cover this afternoon. So Talking Mats is essentially a communication tool. It's a framework to support people to engage in communication. So why do we need to communicate? So it's to enable us to express our needs and our wants. It enables us to give and receive information. It's all about social interaction to develop those connections and that belonging, and for us to be better understood. Now, normally, most people can do that through their verbal and their non-verbal cues. But what we know is when people do develop certain conditions, communication can become more difficult. And that's where a framework like Talking Mats can really come into play. If we look at certain conditions, for example, dementia and learning disabilities, which is the field that I work within, the evidence shows us that there are difficulties with communication as the disease progresses, particularly in dementia. We can see that people will go on to develop difficulties with their comprehension, their verbal expression, reading, writing, and retention and memory. For people who've got a learning disability, what we tend to find is up to about 50% of people will have some difficulties with communication. And another area that often we see within the care home sector that I've worked in was stroke and that as well. And when somebody has a stroke, they may have an increased risk of developing speaking, understanding, reading and writing difficulties. So we can see the need for communication, but there are some barriers to communication in certain conditions and that's where, again, that framework of Talking Mats can really come in to support people to communicate. So my background as a podiatrist was working in care homes and within learning disabilities. So when I was treating my patients, I was seeing a lot of patients with these communication difficulties and often felt that I was still making decisions for them rather than having them at the centre of the care and enabling them to really be involved in developing and shaping what their treatment plan was like. So I was really looking for something to help me, to help people to be more active in their sort of goal setting and their treatment planning. So what I found is with these people who have communication difficulties within my care home setting, they also had foot health problems on top of that. And what the evidence shows us within some of these settings is there is a high prevalence of foot conditions within a care home population and within the learning disability population that as well. And when we add in these communication difficulties, often these go underdiagnosed because they can't report them as easily as ourselves, where if I had a sore foot, I could quite easily say my foot really hurts and get treatment. Often some of these patients aren't able to say that or sort of be able to let someone know that they're having pains and difficulties with their feet. So often they can go undiagnosed and sometimes can come throughout in behavioural changes and things like that. So to support people to really communicate, it was important for me to be able to work with people and look to see what was available out there to support these communications, knowing that foot health was an issue and that communication was difficult within the sort of cohort of patients that I worked with. And that's kind of where Talking Mats came into it for me. And that's where I really started thinking I need to find ways to involve people much more in their care, because we know when people are involved in their care that the outcomes are better for the person, the likelihood is they'll be more satisfied with outcomes, there's likely to have improved quality of life, and the healthcare is more effective. We're able to really tailor the treatment plan towards them instead of following a pathway which might not be suitable for them. And that's why it was really, really important for me to look to say, how can I support people to be engaged more in their care so that essentially I'm delivering the care that these people are needing and are looking for. And I say that's where kind of Talking Mats came into it. So what is Talking Mats? As I say, it is a visual communication framework. The vision for Talking Mats, which is a social enterprise based at Stirling University, is to improve the lives of people with communication difficulties by increasing their capacity to communicate effectively about things that really matter to them. So what I'm going to show you over the next few slides are sort of a few examples of some Talking Mats so that you can really see the tool, because I say it is a visual communication framework. So I want to let you see what it kind of looks like. But for me, what would be interesting at the moment is if we could run another little poll just to see how many of you have already maybe used Talking Mats and have got an awareness to Talking Mats. So if Wendy could do another poll, that'd be fantastic.
So we're just going to ask a yes/no question first. So do you use Talking Mats? Okay, everybody's pretty quick at answering the poll questions today, which is great. I'll leave it open a little bit longer. Okay, and we'll close it now and I'll share those results. So actually 20% of the audience today, Karen, do use Talking Mats, but 80% of the audience don't.
So that's really good to know, kind of that they're sort of in use there, but there's also potential, hopefully, that some of you at the end of this presentation might see a use for it within your sort of area working that as well. So I'm going to move on to the next slide that shows you the electronic version of Talking Mat. Because with Talking Mats there is an electronic package, but there's also the sort of physical package where you use a mat and you put your set of cards based on what the topic is going to be. So as you can see from the electronic version here, it is very visual. The pictures are there to sort of display what it is you're trying to discuss. What you need with the Talking Mat is you need your topic. So there are already preset cards designed by Talking Mats based on some of the topics. So the card at the bottom there where it says topic, this topic that we're talking about in this mat is specific about where you live. So every Talking Mat will have your topic, which will sit at the bottom there as a reminder of what the conversation is about. Every Talking Mat will have that top scale at the top where you can see the sort of yellow cards where you've got the thumbs up, kind of not too sure, and the thumbs down. With the top scale, these are interchangeable, so it depends on what the conversation is, the information that you're wanting to have as to what that top scale may be. We'll never go for a straight yes, no, because we want to have open questions. We want to try to find out as much information from the person as possible. So it's really important that you set the top scale according to what you're kind of looking for here. So for example, with this one, where you live, so we could have the top scale here with a thumb up being happy with, thumb down, not happy, and in the middle, I'm not sure. And then within the set, you'll have lots of option cards. And it's up to you kind of which ones that might be relevant for the person. And you also have blanks in that as well. So if there is something that's perhaps not in our preset cards, the person has that option of having something very specific for them in that as well. So what you do essentially is you ask an open question to the person who's doing that you're doing the Talking Mat with. And it's very much about giving them their ownership. So you are the listener and the person is the thinker. So it's all about giving them the time and the space to be able to process the image and place it under which sort of heading they think is appropriate for them. So for example, in this mat, we're talking about where the person lives. So it's about someone that's moved into a care home, and we want to find out kind of what's going well in the care home, what's not going so well, and what they're not so sure about. So as I say, if we're doing the top scale, is happy with, not happy, and unsure. So from this mat, once it's complete, what we can see is the person's quite happy with the activities that are going on, the gardening, the staff, they feel safe, and they're quite happy within their room. But then if we go to the side with the thumbs down, the things they're not happy about, we can see the person's having issues with the bathroom and the toilet, the lounge and other residents. So that then allows us to start thinking, what can we do to make this better for the patient? We can start to create our action plan. Because that's the really good thing with the Talking Mats is once you've got the mat in front of you, it's about how do we use that information now to support the person that we're working with. And that's where you can go into then create your action plan based on the information. So as I say, this is an example of our sort of preset mat already in the electronic version. What I want to do is show you another mat on the next one, and it just shows you the difference when you change the top scale. So I always like this slide. I think it's quite, so I'll just get the listener and the thinker names up there. So this shows when you change the top scale, the information that you get can change. So you can ask various questions based on what the topic is actually about. So both of these use the leisure away sets, but the top scale in them are different. So the first one to your left-hand side is like and don't like. So we're finding out what the person likes to do with their leisure time away from home and what they don't like to do. And then on the other side, the right-hand side, we're actually finding out what the person does and what they don't do. And what I always find really interesting with this one, you can see that the person likes going to the cinema and seeing friends. That's what they like to do. But if you go to the things that they're doing, then they're not going to the cinema and they're only seeing friends some of the time. So it starts just building a picture to say, so why is that they're not doing it? And is there something that we could support them with to enable them to do the things that they like? So that's where the top scale comes really important there, so that you're finding the information you're looking for and then can create the action plan based on it. So that's kind of a brief overview of what the Talking Mats look like. If you're interested in doing Talking Mats, there are training sessions that you could go on to do that, but I can talk about that kind of nearer the end there. There is a lot of evidence to support Talking Mats, as I say, as based at Civil University, and it is a social enterprise. And can I just say the people at Talking Mats are absolutely amazing to work with. So if you are interested at all, I would really suggest having a look on their website and getting in touch with them. They're really a fantastic group of people to work with. There's a lot of evidence to support the work. particularly around about stroke, learning disabilities, dementia, and children with additional support. So you can have a look on our website, or if you have a sort of literature search, you'll find there is a lot of work out there to support the use of talking mats there. Some of the key findings is that it helps people to say more, and it improves the quality of what they have to say. So it just gives you such a wealth of information when you do the talking mat for somebody that does have communication difficulties, and you may not be able to have that back and forth one-to-one verbal communication. The reason why it works, essentially it gives control to the thinker. The symbols support understanding by breaking the topics down, and it's really giving the thinker processing time. With talking mats, it's really important to be comfortable with the silences. It's about presenting the card to them, what the option is, and really giving the person time and space to process it and allow them to put their card down, and you as the listener be non-judgmental. And it's very much, this is their mat, it's their ownership, and it's about them having the space and freedom to be able to express themselves. And so it supports expression of personal views and feelings and helps develop self-identity. The really good thing with the mat is it focuses attention, whether it's physically in front of you or whether you're using the electronic version. If the person's attention is lost in the conversation, the mat is still there in front of them, so it's a good way to bring the conversation back to the topic that you're talking about, because it's sitting in front of them. So it really does support memory, and that side-by-side listening as well is shown to help reduce anxiety as well there. So it's just a fantastic resource to have in your toolkit to support communication for those who may struggle with that verbal communication back and forth. Talking mats, as I say, there is a wide range of resources already available, so do have a look. There may be some that already meet your needs, and certainly when I started my talking mat journey, I started using the preset cards. But what I did find is that there were some questions I wanted to ask that I wasn't able to, and that's kind of what started me on my journey working with talking mats to develop a podiatry specific set, which I'll go into tell your kind of journey now as to what that looked like. So it's been a long journey, but it's been really rewarding, and I've met some fantastic people along the way, and hopefully we've made a resource that has really helped to start to support people to talk about their foot health. So I was initially introduced to talking mats probably about 7-8 years ago, and it was through my learning disability speech and language colleagues and NHS Fife, who were trainers and were able to deliver me a training session. And you know, when you go to a training session, it just clicks, so you have that light bulb moment, you think that this is amazing, I have so much potential I can see with this within my practice. That was the big moment for me when I was at this training, and I just seen so much potential for it, having, as I say, previously spoken slides of the issues we were having sort of with communication and foot health issues. I really thought, wow, this could really open up a lot of kind of avenues to support my sort of patient treatment plan, care plans, goal settings. So I started to use the resources that were already available, particularly the kind of activity leisure resources, the health resources, and was able to start getting more information than I had previously. But there were still some questions that I wanted to ask that the sets just, I guess, weren't really enabling me to. So I had went on some training at the Talking Mats at Stirling University to become a trainer myself, because again, I loved the resource so much that I felt that I wanted to learn more. So I became a trainer, and it was whilst I was at the campus at Stirling Uni that I'd met the guys there, Lois and Laura, and was able to sort of float the idea about having a podiatry specific set, which they were fantastic about and got really behind the idea and were so supportive, and really wanted to look to work with us. So I was just kind of infused with that sort of the kind of, I had the idea, I had the support. It was just now about kind of finding the funding to be able to look to create this resource there. So getting the funding itself did take a little bit of time, but we did get the support from the NHS Fife Charity Trust, who were able to fund the bid and the project, which was fantastic. And as a result, we were then able to commission Talking Mats and be able to go about creating the Talking Mat resource in collaboration with NHS Fife Podiatry and Talking Mats. So we initially started to collaborate during COVID, so we did it all via Teams, as everything was done then. So myself, Lois and Laura from Talking Mats and a few of my colleagues from NHS Fife Podiatry got together to start really working on what the structure would look like. What is it what are the conversations that we're trying to have that we currently can't have, and what would the resource look like. So we did a lot of mind mapping, had a few sessions saying back and forth as to what it might look like. And from that, we were able to identify 3 key topics that we wanted to explore. So, as I say, my sort of area of work was on care homes and learning disabilities, but within that, a lot of it was sort of the tissue viability side of podiatry, so a lot of the wound management. So the topics that we looked to create was a tissue viability set, and within that we did 3 topics: the sort of prevention, how could we prevent foot ulcerations, what would people's views about preventive measures look like, what was the impact of having a foot ulcer on the person, and what were people's views on the treatment options available to them. So those were the 3 key topics that we looked to develop and explore. So once we had identified these, we started thinking what the visual images would go with them. So we sort of had batted a few ideas back and forth what these images would look like, and Talking Mats were able to then go to their artists and produce the images based on sort of what our ideas were. Once we had got the pilot set in, we then looked to test it within NHS Fife. So we had trained up a few more of my colleagues within NHS Fife so that we could go and test it with some of our patients to get a real feel for, is it meeting the needs of our patients essentially? Does the pictures represent what we're trying to find out, what the patients are what to try and tell us? Do the pictures make sense to the patient? So it was a really good time to trial it and get that sort of patient feedback. And from that, we were able to make changes to the symbols and add in a few extra options we hadn't thought about, and just make some general alterations to the set so that it was kind of meeting the needs of our patient group. And then once the pilot phase was complete, we were able to then start rolling it out within NHS Fife. So I'm just want to show you the sets that we made, and you can see the sort of yellow sets at the bottom. We decided to go with a top scale with want, not sure, and not want. But again, these can be interchangeable, and it might be that you want to find out something else. But those were that was sort of our main sort of headings that we went with. And within the prevention category, we were really looking at what we would look to see where we could prevent foot ulceration essentially. And we wanted to get patients' opinions of what they would be willing to do, what they'd be willing to change, or what they don't want to change, and what they're maybe not sure about. So these were the sort of core options that we had thought about. But as I say, there are blanks within each set because there might be something specific to that person that we've not thought about, and it gives them the opportunity then to share that into the set and that as well. So this is our prevention set, and this is then onto our impact set. So this is about the impact of having a foot ulceration. How is it impacting on the actual person? And for our top scale there, we went with going well, sometimes going well, and not going well. And then as I say, these were all the options that we went with, such as coping with dressings, coping with pain, being able to get out and about, bathing and showering, because we know that having a foot ulceration can have a significant impact. So those were our sets that we went with for the impact. And then we had our treatment options. So when you've actually got a foot ulceration, what are the treatment options, and what is it that you would consider and not consider? For somebody that, as you can have that verbal communication with, they're able to probably express that some of the things that they're willing to do, not willing to do. So some people might say, well, I'm not willing to go into hospital, I'm not willing to have an amputation of that. But somebody that does have communication difficulties, often before we were following a pathway, and this set now enables us to actually be really patient specific around about the treatment options that are available to the person and whether they want to go into hospital. Well, not that most people want to, but whether that would be an option for them, whether they're willing to go for x-rays or MRI scans and things like that. So it just opened up that conversation for people to be able to express their views for us. So those are the 3 sets that we've developed, and I'm just want to share a bit of a case example with you for one of my learning disabilities ladies, who also has a diagnosis of dementia. She's 60-year-old, and I've known her probably for about the last 5 years. She's a lovely wee lady who lives quite independently, still living in the family home from her parents who are no longer with us, but she's very comfortable in her home, feels very safe and very secure, and very much wants to maintain living within the sort of family home there. She has some support from community services who come in to support her with her personal care, with doing her shopping, paying her bills and that, but otherwise a fairly independent lady. She also has district nurses coming in due to leg ulcers, so there's people sort of popping in and out to see her on a regular basis. We've known her for many years due to repeated ulceration on the sole of her foot. We have made that, well, we've not made, but we've referred her to the orthotist who's created specialist adaptive footwear for her. But unfortunately, even with these, she was prone to breaking down. As I say, she's a lovely wee lady, but she never ever wants to cause a fuss. So when you ask her how things are going, everything's fine. Nothing ever bothers her, you know. It's not sore, it's not bothering her, she's absolutely fine. She can do everything and that. But my sense was that everything wasn't going fine with it. We've got this wound that wasn't wanting to heal, or when it did heal, it kept reoccurring. So really wanted to try to get down to the nitty and gritty as to what's going on with it. So I thought a talking mat might be the perfect tool to try with it, to see if I could find it maybe a wee bit more, because I just wasn't convinced that everything was fine with it. So I had took my talking mat along, I took my cards along, and I did the impact set with her to find out what impact this foot ulceration was having on it. And it turned out when we did the set and we lay it out in front of her and we gave her the cards and she was able to put them under each of the headings, it turned out she was actually having some difficulties with the dressing that we had put on. So we were putting a dressing on and we were using some bandaging to secure it. And what she was finding is that it was making it a wee bit uncomfortable in her shoe, but she didn't want to tell me that. She just thought, this is the dressing I've got to wear, so I'm going to wear it. But we did find out that it was causing her some discomfort with the shoe, because it was just making it a little bit tighter. So she was tending to not wear the shoe around about the house, or she was sort of fidgeting with the dressing and things like that, just to try and make it a little bit more comfortable. And she was actually in pain with it. But when I had asked her, you know, how things were going, was she in any pain, she kept telling me everything was fine. But the mat told us that it wasn't. The mat told us that actually she wasn't coping too well with the pain. So from that, we were able to make an action plan from it. So I was able to change the dressing to less bulky dressing. It did mean increasing the visits to see her, but that was fine. We were dressing it initially at once a week, but we changed it to twice weekly by changing to an adhesive type dressing, which took up less room in her shoe. But that was much more suitable for the patient. And also we were able to add pain relief. We were able to prescribe pain relief for her as well. So what I did was I did another talking mat several weeks later to see sort of with this introduction of the pain relief and change to the dressing, how things were going. And we were actually seeing that actually no longer were the dressings an issue for her, and no longer was she experiencing pain from it. So she was much more satisfied, and actually everything was now fine. Thankfully, there was nothing sort of new had come up in the mat from us doing that. The wound had then went on to heal. It has remained intact, but unfortunately she has developed ulcers elsewhere. But that's a different story. But it just showed the wealth of getting that information to the talking mat, that actually, had I continued with everything's fine, it's fine, it's fine, then we wouldn't have added pain relief in, and we wouldn't have changed the dressing, because it was managing the exudate levels, and to my knowledge before the talking mat everything was fine. But when I actually was able to get that information out, where I was able to make a change which had sort of much better outcomes for the patient, she was much more satisfied, and sort of we were able to manage her pain, which meant she was still able to do her daily activities in the house, because that's really important to her. We found out when we were having our chats and that, for her to be able to keep doing her housework and helping the girls when they came her shopping to lay it away and things like that. So by keeping her active and mobile, we were supporting her to do that, and hopefully we'll help her to maintain at home for as long as possible. So that's kind of one of the examples of a talking mat that I've used. I've used them many other times than that as well, and we've had good examples where I had a patient who had a foot ulceration and suspected that she had a bone infection, osteomyelitis, and was really keen to get her an x-ray. From when I was asking if we could get her to the hospital, it was no, she didn't want to go. When we did the talking mat, we actually found out the problem. She didn't want to go, she didn't have transport and didn't know how to get to the hospital. But we weren't able to get that information from her verbally. So by doing the talking mat, I was able to actually explore that she actually did want to go in x-ray. It wasn't that she didn't want the x-ray, it was just turned out that she was transport. So we were able to get a patient transport, got her up for her x-ray, and was able to then implement an appropriate treatment plan as a result. So it's a really good resource for the right patient. It's not something used for every patient, but you start identifying patients where it might be able to give you that bit more information that can really help to support your treatment planning. From that, so that was a resource that we created in NHS Fife, and it's been running sort of since 2021 now. They've sort of finalised set, but we were really keen to look to spread it out further, that it wasn't something that really we wanted just to keep in NHS Fife, because there's potential that it could benefit everybody and anybody who's got a foot health problem. So we wanted to start sharing it out. So in collaboration with Talking Mats, we'll look to develop a foundation online programme, and we run our first cohort of this last year in September and November, because it's a 2-day sort of course that you attend on Teams. And we had 4 health boards participated, which is really exciting, and we got some really good positive feedbacks on how to develop further. Because I say this is a tissue viability set that we made, but we really see the potential that, you know, there's so many other sets in podiatry, and I'm sure other professions in that as well. Because I would love to look at sort of musculoskeletal type things, falls prevention. One of the big things that came up from our podiatrists at the 2022 course was round about nail surgery, and there's so much potential round about the sort of nail surgery, and where you could be looking at patient views and opinions round about that as well. So it's really exciting that we've got those sort of 4 health boards now that are hopefully starting to use it there. And we're looking at this year to run another course in April and June. So hopefully we'll be able to get more people involved in that, because it's a resource we created, but we want to share it. We want people to benefit from it. So it's not something that we wanted to kind of hold in NHS Fife. It was something we wanted to share out there. It is something you do have to go in training for, though, because you need to know how to actually deliver a talking mat, well, not deliver, but to run a talking mat session, so that by the end of the conversation you're able to say this is a true reflection, because it's based on the evidence around how a talking mat is delivered. So it is something you do need to go on a training course to learn. It may not be that you need to go on a podiatry specific one. I know there's a lot of OTs and other people on the call today. If you have a look at your own health boards, there may be some trainers already within your health boards that are delivering talking mat sessions. But as I say, have a look on the Talking Mats website. They run foundation courses for more than just podiatry. There's lots of different foundation courses that run in that as well. So it might be something that you might find that you're interested in and can sort of pick up from there. But as I say, it was the course that had that light bulb moment for me. So hopefully others will find it as beneficial in that as well, because I just think it's just another resource that you can have in your toolbox to support communication for patients. I'm really excited for the development of the podiatry resource and where it could potentially go. Really keen to look into the future and do some research round about it and really see sort of what difference that is making to patients, and hopefully improving kind of outcomes for them. There's a few QR codes here if you're interested. Talking Mats have got some free resources available. You can have a look at some of the blogs that are out there and some of the research that's available in that there as well. So if you're interested in finding out a little bit more, I would definitely recommend having a look at the Talking Mat resources that are out there. And that kind of takes us to the end of our presentation today. So Wendy's got another poll question that she's going to ask just to see what your thoughts on Talking Mats are. So I'll kind of hand it back to Wendy at the moment.
Thanks, Karen. That was really interesting. So what we might ask now is kind of finding out what people in the room are thinking about. So is Talking Mats something that you might now think about? So most of us in the room might have heard about it, but it wasn't something that we were using. So do you see an opportunity? What I'm also going to ask as people are putting their answers to the poll back is to let us know what your questions are for Karen. So if you've got any questions that you want to put in the box. We'll leave that open a little bit longer. So okay, and that looks like majority of people have let us know. So we'll close that and I'll share the results. So Karen, 74% of us in the audience are thinking that yes, this Talking Mats is something that we might now think about, and 26% people are thinking possibly, and nobody's thinking not really, which is really interesting.
I think certainly, because it was just a bit of an overview today, but I think if you can get yourself on one of the courses and really see what it's about, and hopefully it will start to open your eyes and think, oh, there is potential here. Talking Mats itself, when you're on it, you'll learn the sort of types of patients you can use it on, because there's a model that you use called circle models, and it really helps you understand who could really benefit from it, and that. So the training is really, really, really important, and really kind of helps to understand where you can really hone in on your talking mats and really get sort of the best out of them for your patients.
Great, thank you very much, Karen. Should we move on to the questions and answers? So I'm going to remind everybody to put your questions. So hover over your screen and you'll see a little speech bubble with a question mark in it, and you can put your questions to Karen. I might kick us off with the first question, if that's all right.
Yeah, go for it.
It was a great presentation. Thank you very much, Karen. I guess what I'm curious about, which is because it's something that we hear lots about, isn't it? But what I'm curious about is the time that it takes to have those conversations. And what would you say back to us about, do you know, does it take more time? Would we have time? Do you need to create time?
It is something you definitely create time to do. What I tend to find is I probably wouldn't do it on my first assessment, because I really need to understand my patient and get a bit of kind of what information that I can get. And it's from there I would then think, would it be beneficial if I've not got sort of enough information, if I think there's still something more, that I would then maybe look to do it on my next visit, but I would definitely build the time into that. Because as I say, we're talking Mats, it's about giving somebody the time and the space, the freedom to communicate. So you don't know, it might be quite quick for somebody might be able to do it really quickly. Others, because of the cognitive impairment, to look at the card, take the information, process it, formulate a response, and then being able to put it onto the sort of mat then, or whether you're using an iPad. So it really does vary, but I would always say build it in. It's not something you want to rush, because you're not going to get the quality information you're looking for. So really plan if you're going to do it, I would say, and build the time in. I know certainly when I did it, I sometimes went and did my podiatry treatment and then went back a few days later and just did the talking mat, not even went in and said, right, let's have a look at your feet, we're just in for a chat the day. So I sort of build that just into it as well. So again, it's just about knowing your patient, or getting to know your patient sometimes, because with the talking mat as well, even though I said it's not suitable for everybody, for those that are more advanced dementia or with learning disability, so it's like a profound and multiple learning disability, and you're not going to be able to say that's what their wants and needs are, it's still a good way to build a relationship, because you're starting to build that social interaction in that. So you could still use the resource as that sort of relationship builder, and trying to kind of gain that kind of trust in that with the person and that as well. So I've often used it with those type of patients and that as well, just as almost like a wee icebreaker, just to kind of try to build a relationship to then support me, hopefully, to go and to treat the patient and that as well. So yeah, it's very individual, I would say, but always plan to have the time there, or go back and with a separate section in mind to do it.
I was really
and I was just going to come in and say what a fantastic presentation, Karen, and I just loved hearing about your light bulb moment, and then your kind of passion for really taking the work forward, and really what that's led to, and sort of spreading out to involve other health board areas, and all your thoughts for the future plans and things as well. And it was great to see what's being offered for people to link in with. So that was fantastic to hear. There's a question as well. I should say, if we do run out of time, there will be a blog posted about the presentation as well. And Karen, you've shared loads of like really good resources and links and things as well. So there will be a follow-up blog. There's a question about the electronic version of Talking Mats, like is that on a certain device, and how does that work? And have you found one works better for people, or have you kind of tried them both, just to hear a bit more about what that's like?
So once you've done the training and that, you then Talking Mats, you sort of sign up, you get a username and a password and things so that you can get access to the online resource essentially. And when you're in that, you've then got, and the podiatry ones are on there, so you've got access to the resource associated with the training and things. You're essentially needing a touchscreen device to do it. So essentially when you set the mat up, you've got your top scale up the top, and you can pick and choose kind of what that top scale is. The good thing about the electronic version is you've got lots of ideas on it, so it's all preset sort of ideas on it and things like that. So if you're maybe struggling to think, what do I want to ask with this? The good thing about the electronic is there's a lot of it preloaded in, so you can think, oh, actually, I'm going to ask that, so you can click on it and it'll kind of load that up onto your screen and that as well. But yeah, once it's up there, essentially what happens, it's like we kind of deck of cards, and the card comes on and you see it, and then the person just uses their finger and kind of moves it under where they want it to be. And then with Talking Mats, when you are doing it, there's part of it called to kind of reflect on it. So at the end, you'll go through it with the person, and they've got the opportunity to then move them, because it may be that actually after they've had a bit longer to think about it, actually this card could go over there and things like that as well. So you sort of can go through it and reflect on it before it becomes a kind of final decision part of it. But yeah, I've used both, and again, some people just like physically hold something in their hand, so that's where sort of the sort of physical mat comes in really handy. But then there's some people that do just enjoy sort of doing it on the iPad. Certainly with the iPad, it's easy for me if I'm doing a house visit to pop it in my bag, or going in the wards to give it a wee clean and things like that. But it's just good to have the two options there, because as I say, it's just for those people that kind of what their preference are and things like that. And you could use the iPad and it might not work for somebody, so you can then use the sort of physical version and find that that's sort of more suitable. But yeah, they're both available and both really useful.
Great, thank you. Will I carry on with the questions? Great, so we've got a question in for Dorothy asking, can it cause contention with other care providers and family? Hopefully not.
I've not found that at the moment. What I did find is I've done it a few times when family members have been present, and that's been quite good, because then they're actually seeing that wealth of information coming out in that as well. I know I did one with somebody and we were like, oh, I didn't realise that that was an issue for them and things like that. So they were able to really understand it and being there to sort of see the person doing it, and not just me coming back to them and say, well, did you know mum and dad had this issue or that? They're sitting there and they're actually seeing mum and dad moving it to kind of where it is, and they can see for themselves in that as well. But yeah, I've never had any issues, I have to admit. Maybe I've just been lucky at that, maybe they're yet to come, but certainly never had any issues. As say, using it in the care homes and that as well, what I found is the carers will often take a photograph of it and then put it into the resident's file and that as well, and be able to say, this is what the resident was able to share with the podiatrist today and things like that. And the same when I've been working with some of my learning disability patients in clinic, the carers that have come brought them into clinic that day, I'll take a photo and take that back and put it into their care plan at home and things like that. So again, they're able to say, this is what person A said on this day and things like this. This is what their sort of results were, rather than again it's sort of second-hand feedback or something. They've got that moment in time represented on an image.
Excellent, thank you. And your example there of families kind of being involved in things, is it something that would be available for like family members to use as well? Do you know?
Yeah, definitely. And I say, if you link them with Talking Mats there to see what sessions and that are available, but yeah, there's absolutely no reason you couldn't use it with your families. I know certainly when I was training, because when you go on the training course and that, you do the first part, then the second part's away, go practice and bring an example back. So at the time I practiced with my daughter, who was still a nursery at the time, and I thought she loved arts and crafts and everything, and I did this sort of leisure set with her and turns out that she really didn't like arts and crafts. So it was quite an eye-opening for me to think, oh, she doesn't like that. So yeah, there's no reason that families can't do it and things. And again, particularly when you look at those things like the chat about what people like and what they don't like and things, so it's a really good way that you could be starting to ask things. And I mean, it's not have to be about activities, it could be about their food, what kind of foods do they like eating and things like that. So you can really tailor it to sort of suit people's needs and things like that.
Excellent, thank you, because I've seen some great examples of family members kind of using symbols and things, or using images and photos. So having that that resource seems like it could be really helpful. So excellent. And there's another question in as well, asking, do you store the mat with the patient's records? What sort of happens?
So what I'll do then is I will take an image of the mat and end it. So we have electronic record cards in NHS Fife, so I'll take an image of the mat and I'll upload it to the electronic image and the electronic record card, sorry, and then that'll be form part of my care plan that I'm basing that on, and that's then sort of supports it to say, based on the talking mat, this is sort of kind of the steps that we're taking as part of the care plan. So yeah, we'd always store it.
Excellent, thank you, Karen. Wendy, any more questions here?
I guess on the back of that, I was wondering, have you ever left the person with a picture of their map as well as a part of their goal setting?
Yeah, so we've done that as well. So we've been able to take images, print them off. Say some of the carers now will take images on their smartphones and things like that. I've had a couple of my learning disability patients and that as well, with their smartphones, they just took the picture and been able to take that home with them and that as well. So yeah, definitely, because it's their mat at the end of the day, so it's about them having the ownership of it, and it's up to them then what they want to do with that information and that. So yeah, we definitely actively support people to do that.
In listening to your presentation, Karen, there was a real, you talked quite a bit about the listener and the talker, and that kind of as a dynamic, and almost that there's more, that the person has more time to talk in the consultation. Do you think that's a difference to what a normal consultation would have been like?
I think so. I think previously, before I was doing talking mats, I would tend to find when I was having the conversations, and when the information was very sort of, I wasn't getting very much back and things with the chat, I would then tend to just look at following the pathways and things that we've got in place. So if you've got a foot ulcer after 4 weeks, we need to send you to vascular or whatnot, rather than being able to have the conversations and things like that. Even though I did look to support the conversations through their sort of welfare guardians and things like that as well, it just meant that we were able to get the person's views in it. So I do think I probably talk less now when I do them rather than more, which is a good thing, because you want the person to be talking more than you. So it does, I do feel much more that people have more ownership now since I've sort of moved in that, and I do tend to now think much more about, even when I'm not doing talking mats in my consultation, about thinking, right, speak less and let the person speak more, because that's what you want for your consultations, that the person's doing more talking than you are. So I have found from even doing that even my practice when I'm doing a treatment with somebody who doesn't have a communication difficulty, that I am much more actively listening, I feel.
That's really interesting, isn't it? There's a question in about where you see it going for podiatry in the future.
Yes, so as I said, these are tissue viability sets, but I just think there's so much more. And certainly when we did the training just at the end of last year with the podiatrists for other health boards, the big topic that came up that most of them were seeing was in nail surgery. So we'll take a lot of toenails off and things like that, a lot of them on children and that as well. So a lot of the chat was that this could be really useful to be able to explore children's views and wants and wishes about getting their toenail off and things like that. So again, just allowing them to express their views and that, rather than sort of, it's a case of they've come in. Now, I don't work with children, so I don't want to put my foot in it or anything like that, but you know, sometimes I know me as a parent, I'll speak as a parent rather than as a podiatrist, but you know, if something's wrong with my child, I'd be quite happy, yeah, let's just get that fixed. We need to get that fixed, sort of thing. Yeah. Whereas the mats, I think, would then allow them that ownership. They would say, but I'm a bit worried about this and I'm a bit worried about that, and be able to sort of, again, just again, whether it's then just alleviating the fears that come with it and that, because you know, it is a bit of fear of the unknown. I'm going in and somebody's got to take my toenail off, and you know, I've heard that there's a big needle involved and things. So you could be doing this talking mats with the sort of kids and that, and really trying to alleviate the fear, so that when they do come, it's a very positive experience for them and things like that as well. So certainly nail surgery was a big topic. we had a few people, there were podiatrists that came that worked in the prison service and that as well, so that was really interesting because, again, not a field I work in, so it was really interesting to see where they could look to develop it within the sort of prison service and that as well. And I think there's a big scope to be looking at sort of our kind of our musculoskeletal type work and that as well, looking at kind of falls prevention and things like that as well. So I do think there's a host of other topics that I would love to look to develop and things like that. So just need to find a new source of funding and look to make my next set.
Oh, and Karen, we'll look forward to having you back on another webinar talking about all the developments and talking about your research that you're going to be carrying out.
I'm very excited about that because I've seen how well it works, but I would love to do some research about it and really sort of hone into it, because as I say, there's a wealth of research out there about talking mats, but obviously there's nothing about our podiatry set. So I'd love to be able to kind of that, for me personally, that would be my next sort of project that I'd love to sort of look to develop in that. That
would be amazing, so it would.
Are you working with Stirling University on that, Karen, or are you yet?
Yeah, so Talking Mats have got a research group, so I've been linked in with them and looking at sort of the NHS Fife research and development team and that as well, just to see kind of how we could go about and what our research question is going to be and sort of go from there really.
Fantastic. It's a really great example of a gap, isn't it? Of where you noticed a gap, a light bulb went on, and then you had some good conversations with people that could help change and come up with something that was really innovative but really effective.
Definitely. And what I loved about it as well was that sort of cross-boundary working in that as well, because essentially it was a tool that speech and language therapists developed and created, and then we're able to sort of spread it out, and then there's podiatry can tap into it. I know when I did my training, my becoming a trainer one, there was physios becoming trainers, OTs and that, so it was more than just a speech and language tool. So they've been able to develop something that's been sort of spread out and can be used by multi-professions, family, friends, carers and everything. But I really enjoyed that cross-boundary working in that as well, because the people at Talking Mats are speech and language therapists as well. So it was lovely to come from a podiatrist point of view to a speech and language and us being able to kind of collaborate together. So that was really nice. And certainly Lois and Laura informing the blend a lot about feet now. I know much more about feet than they probably ever wanted to know.
So I'm not sure, do we have any other questions, Alison, or have we answered most of the questions at the moment that people have?
Yep, I think so. I think that's been absolutely brilliant, Karen, and we can just totally hear your passion for this work and through the collaboration and the partnership working to try and achieve the best outcomes for people, and really excited to hear what's next. So we'll look forward to your blog as well, and I'm sure we'll be hearing lots more for you as well about this work. So thank you so much.
Oh, thanks for having me.
Yeah, can you go to the next slide then, Karen?
Yes.
So we're giving you back the gift of time this afternoon. That's an extra 5 minutes, and we'd recommend it's a beautiful blue sky, sunshine in Dumfries and Galloway this afternoon. So if you can go outside and get some fresh air and move, that's a great thing to do for your own well-being. So thank you so much, Karen, for coming and sharing all your work. Thank you for Alison being on the panel, and for all of our audience, and for those who are listening again. So our next webinar is the 26th of April, and that's actually going to be led by our paramedic, AHP partners and Scottish Ambulance. So thank you everybody for joining us, and I'll say good afternoon.